my question is about the contractile dysfunction that you see in athletes, that you said that is way more often than the normal population, and considering that they are in like a high performance sport. So how do you deal with that, with that syndrome, that problem, and how do you deal with the loads? So do they have to stop their training? Do they have to reduce their training? Do they reduce it if you recommend? And how do you progress loads? Because I assume they probably need a lot of load to get on their point of pain or to be like effective. So how does that sound with combining that type of treatment with that type of athletes?
Yeah, so great question around the contractile dysfunction with the athlete. So for those listeners who are not sure, contractile dysfunction is akin to tendinopathy that we hear in the literature. So contractile dysfunction, it has so many variables that we need to consider, and as we know, contractile dysfunction will present in different ways. So you may have an athlete who has just literally changed something in their training routine, and a day later or 2 days later, they develop these symptoms and this swollen tendon. And how do we manage that compared to an athlete who has several months worth of a consistent pattern in terms of a tendon-related problem? So there's lots of variables, and you've really got to consider at what stage is the condition. Is it something that we need to unload because they have suddenly loaded up their tissue, or is it something that we can actually implement a loading program? So I think when you're with an athlete, you need to get an understanding. One, their age comes into it a little bit. So, a younger person in their early 20s with a contractile dysfunction may be quite different to maybe your master's athlete, so a person much older. So you need to consider their age. You need to consider their sport. What are they doing in terms of, is it a high explosive type sport like sprinting or hurdles or a high jump or a javelin thrower versus maybe an endurance sport such as cycling or road running, swimming, these sort of things. You need to consider where are they at in terms of their competition and tournaments. So are they during season or is it in the off season? And how do you manage those differently? So obviously if it's during season, then you're going to have to manage it quite differently because they're still wanting to compete, they're still wanting to play. And is it appropriate for them to be competing and playing? Or are they in the off season where potentially you've got more room that you can actually structure their rehabilitation program a bit more around that rehab of that condition versus potentially working in with other aspects when they're during season? So all of these things you need to consider. So if we think about that more acute onset, and we sort of consider the continuation model that Jill Cook and her colleagues have proposed, because that fits really nicely with the way that we would manage these patients. So if we have that reactive tendinopathy, so that more acute contractile dysfunction, the cause of that is due to some change in their load, so some increase in their load. So we need to have an understanding of what training have they done over the last sort of few weeks that has resulted in them causing this problem. But ultimately, we will need to unload that tissue to allow it to settle down and then load that tissue back up to the point where they're able to participate again. So that needs to be a very structured way of doing that. Versus the more chronic contractile dysfunction, which basically that tissue doesn't have the capacity, doesn't have the strength or endurance to do the activity or sport that they need. So this requires more strength-based program, maybe looking at endurance as well, maybe looking at explosive or plyometric exercise as they improve. So it really is dependent on how the patient presents, at what stage they're at in terms of their training, competition, to then what we need to be doing to manage it. So it's not a one-size-fits-all approach. We need to think about all these different variables in terms of their management.